Good afternoon, everyone. I'm responsible for the Inquiring Minds monthly series under the auspices of Toronto Mensa, and I warmly welcome you to this Zoom edition. And my name is Kathleen Smith. It is my pleasure and, in fact, my honor to introduce today's speaker. Dr. Robert Caron is a clinical psychologist in private practice in New York, and he's an award-winning author of a book called The Forgiving Self, among other books. His two cover stories for The Atlantic magazine on the subject of shame and attachment were honored by the American Psychological Association for Best Psychology-Related Journalism. His work has also appeared in New York Magazine, The Nation, Contemporary Psychoanalysis, the Psychoanalytic Quarterly, the Yale Review, Vogue, and elsewhere. He is an adjunct professor in the postgraduate program in group psychotherapy at Adelphi University. Becoming Attached, I have this edition of it. Becoming Attached is one of the most important books ever published in the field of developmental psychology. And it has been praised by leading researchers in that field. When I was working at the Hospital for Sick Children, the scientist that I was reporting to told me that I must read this book, which I did with fascination. Now, just very recently, the 30th anniversary edition has come out. Attachment theory proposes that there are different styles characterizing secure and different types of insecure attachment between developing persons and their caregivers. There are different consequences of each attachment style for the development of relationships with others, for our personalities, and even for the underlying connections in the brain. Attachment styles are still important in adolescence and in adulthood. Dr. Caron looks forward to taking your questions after he talks. So, welcome, Dr. Robert Caron. Over to you.
Okay. I'd like to start by talking about the way things were. In the early part of the last century, orphans were typically warehoused in institutions. Most of these institutions provided the children with nothing in the way of maternal care. The infants were sometimes prop-fed. This was a very ingenious practice. Prop-fed, their bottles hung over them so they wouldn't have to be held during feedings. There was little play, no joy, no love, barely any interaction at all. And even though it was widely known that infants in orphanages often failed to thrive, with many withering away and dying, the obvious conclusion that they needed maternal care or something like it was resisted. People who wanted to adopt would come to these orphanages. They would often find a pleasant child, meet with her several times, and then take her home with loving expectations. But in the 1930s, a heartbreaking truth began to emerge. Doctors in the new field of child psychiatry were reporting adoption failures. They described children who were different to the point of who were indifferent to the point of heartless. Affectionless, they were called. Some were deceitful, some thieving. They would beam at a stranger, call a man they met only for the first time daddy. But beneath this indiscriminate affection lay an impenetrable coldness. Some of the adoptive parents believed that with enough love, They would penetrate the child's mistrust. But for many of these children, it seemed too late. As one mother put it, I have no more idea what's going on in that child's mind than I knew the day she came. David Levy, a psychoanalyst who worked with many of these families in New York, said of another mother, she felt she had been taking punishment for a year and could no longer stand it. Levy's cases shared many similar features, lacking pride in themselves or care for others, and displaying incorrigible behavior problems. These often included sexual aggressiveness, fantastic lying, stealing, temper tantrums, immature or infantile demands, and failure to make meaningful friendships. And then there were the parents, pained, frustrated, at wit's end. None of the children seemed to respond to psychotherapy. In one extraordinary case, a child who had shown no progress in therapy was sent by her adoptive parents to Vienna, where she lived with an Algerian psychiatrist who treated her for 3 years. The child returned home with the same emotional flatness and more alarming aggressive symptoms. The accounts of Levy and his peers received little attention. Many psychologists believed that parental love was overrated and that children got by with good physical care and minimal amount of stimulation. One famous psychologist, John Watson, opposed giving a child too much affection. His book remained influential for decades. Here's a quote. Treat them as though they were young adults. Dress them, bathe them with care and circumspection. Let your behavior always be objective and kindly firm. Never hug and kiss them. Never let them sit on your lap. If you must, kiss them once on the forehead when saying goodnight. Shake hands with them in the morning. Give them a pat on the head if they have made an extraordinarily good job of a difficult task. Watson warned against picking up a baby when it cried. Many loving mothers followed such advice. It felt wrong, but they didn't want to spoil their babies. I knew a mother from the 1950s, a developmental psychologist herself. When her baby daughter cried, she watched with anguish, cried along with her, but did not pick her up. The idea that babies were uncomplicated creatures who didn't need much in order to get along was pervasive. It struck the right chord in a world that had changed radically in the 2 centuries since the Industrial Revolution. The conditions of society made such belief soothing. In hospitals all over the world, children, even very small ones, went into the wards and parents were barred at the door. They were allowed to visit once a week for an hour or two, or in many cases, not at all. One mother described the ordeal. When we went in, she cried for a moment, then brightened up for the rest of our stay. As we prepared to leave, she would stand at the end of her cot, desperately crying, desperately trying to climb out, something she never did at home, purple with rage and screaming with grief. We left her like that every time. Derek was a well-adjusted child from a happy family. At 18 months, he contracted diphtheria and was sent to the hospital. During his 9-month stay, he was not allowed to see his parents. Remember, this is an 18-month-old child. When he finally came home, he seemed a stranger. He called his mother nurse and showed no affection. His mother said that it seemed as if she was looking after someone else's baby. After a year and a half, he remained strangely detached, unmoved by either affection or punishment. His mother described him as hard-boiled. His therapist at a child guidance center in London was a young psychoanalyst named John Bowlby. He would soon shatter this system and the set of beliefs that went with it. Bowlby first became famous worldwide in the 1950s for warning against the dangers of maternal deprivation. He not only collected the evidence from numerous child care workers like David Levy, he also proposed a new way of understanding child psychology, building on the work of ethologists who had observed the close family relationships of other species. Bowlby put love at the center of his theory. He said for the human baby, relationship seeking and proximity to the parent were paramount. He put his ideas together in a package he called attachment theory. Bowlby argued against early separations. He opposed taking children out of their homes because they were dirty or ill-fed. He argued that more support be given to help families stay intact. He wanted unlimited hospital visitation for parents. His influence on social work and hospital policy was worldwide, but he couldn't convince his peers. When I met Bowlby in 1989, he was still an outcast in the psychoanalytic world, which had been his first home. Bowlby had dared to insist that the seeking of attachment bonds was inborn, and that the love parents feel for children is the result of an evolutionary need. In 1944, Bowlby published a paper called 44 Juvenile Thieves. In this paper, he established that most of the affectionless, thieving children he'd studied had suffered the loss of their mother or a long separation from her at an early age. In 1951, the World Health Organization, a department of the new United Nations organization, asked Bowlby to do a study on the needs of displaced children. In researching his paper, Bowlby discovered the work of David Levy and the other New York psychiatrists, whose papers on maternal deprivation and affectionless adoptees had been largely ignored. Bowlby's subsequent book, Mother Care and the Growth of Love, was an international bestseller. In 1956, Bowlby hired James Robertson, a social reformer and amateur filmmaker. The film Robertson made with Bowlby, A 2-Year-Old Goes to Hospital, documented the small child's anguish at being left in a hospital crib for a week. The film was dismissed and denigrated at first, but in the end was deeply influential. It helped change the hospital policy throughout the developed world. Bowlby was winning the game on maternal deprivation, but he still had something bigger to prove. He wanted to show that gross traumas like separation and loss were not the only cause of psychological distress in small children. Rather, it was the smaller, everyday wounds, the rejections, neglect, loud scoldings, unloving attitudes that left the most scars. And then came Mary Ainsworth. Ainsworth, a Canadian psychologist, showed up on Bowlby's doorstep in 1950. She was answering a help wanted ad Bowlby had placed in the Times for a research assistant. When he interviewed her, Bowlby knew at once that Ainsworth was a perfect fit for his team. She had not only the requisite skills, but interests that coincided with his to a remarkable degree. Indeed, she was interested in emotional security, the very thing that energized Bowlby, and what types of parenting promoted or discouraged it. Answering Bowlby's classified ad would prove to be one of the most significant acts of her career. Ainsworth was a scientist of Bowlby's caliber. She was intelligent, subtle, an independent thinker, sensitive to what empirical data demonstrated and what it did not. But their personalities were markedly different. Bowlby was a leader with a commanding presence. He had a conviction in his correctness that only grew stronger in the face of opposition. Ainsworth, although tough-minded intellectually, was more retiring interpersonally. She was prone to self-doubts when encountering rejection, which she would soon face on a grand scale. If Ainsworth did not have destiny writ large in her features, she quickly recognized that Bowlby did. She was taken with his ideas, but she was struck too by his formidable and apparently secure personality. I say apparently with awareness of the implications there. She told me, quote, John made no bones about the fact that he was single-handedly fighting the analytic establishment, that it pained him some, but that he was convinced he was on the right track. It was a long time before I felt any sense of getting close to him or being a friend, but I had no difficulty whatsoever making him into a surrogate father figure, even though he's not much older than I, unquote. It was the beginning of a professional marriage that would prove as fruitful and enduring as any in the history of psychology. During her 3.5 years with Bowlby, Ainsworth caught up on the issues that concerned him. Why does a baby need a mother figure to develop normally? Why is it so adversely affected by a prolonged separation from the mother after the relationship had been established? Why, when they are united, especially after a depriving separation, is the child so deeply upset? In fact, so upset that the original relationship may not be recovered for a long time, if ever. She had parallel questions about herself. She wanted to understand her own insecurity, which was not based on separation or losses, but which she nevertheless suspected had something to do with her early years and her other self-absorbed and distant mother. And so the question formed, what goes on between the mother and child in the first year of life that lies behind all this? This question, brewing since graduate school, became so important to her now that she was determined that when she had her own project, it would be a study of the mother-child relationship in the first year of life. In 1954, Ainsworth found herself in Uganda, excuse me, where her husband had taken a teaching job. Ainsworth soon launched one of the pioneering studies in modern infant research. With no lab, with meager institutional support, with no help collecting or analyzing the data, with no one but her interpreter, she rounded up 28 unweaned babies from several villages near Kampala. She began observing them in the home. She used the careful, naturalistic techniques that the ethologists, Konrad Lorenz and Nico Tinbergen, had applied to goslings and stickleback fish. Here's a quote from the book she published afterwards called Infancy in Uganda. In it, she describes a child, desperate and wailing, and his mother who attended to him, but did so in a perfunctory, unloving way. We found Mohammedi, she writes, sitting outside the house, crying bitterly. His sister was lying on a pile of clothes near him, appearing very ill and paying no attention to the baby. The mother appeared from behind the house where she had been working. She ushered us into the house, giving first attention to the polite greetings. She then went out to get him and put him to the breast immediately, without stopping to wipe his nose, which was streaming, or to wipe his face, which was muddy. Mohammedi's mother ultimately struck Ainsworth as disturbed herself. Quote, a masochistic person, she wrote, who always did things the hard way and who compounded the difficulties that a malign fate had visited upon her. Despite such observations, Ainsworth could not confidently enumerate the specific maternal behaviors that made the secure infants secure and the insecure infants insecure. Sharp boundaries that might differentiate the two were hard to come by. Then Ainsworth had an inspiration. She devised a procedure called the strange situation, in which these same mother-baby pairs were observed in the lab. Different patterns of relating emerged. She videotaped and carefully studied how the baby handles it when mother leaves the room and how it reacts when she returns. These patterns coincided remarkably with how the mother had cared for her child at home. Mothers who were sensitive to their children's needs, who picked them up when they cried, who were attuned in their emotional state, to their emotional state, who were steadily warm and available, had children whom Ainsworth evaluated as secure. The children she evaluated as insecure had mothers who were cold or inconsistent or neglectful. Researchers soon realized they had a tool. They soon realized the tool they had been handed. It not only offered the first empirical evidence of the impact of quotidian aspects of maternal care, but also offered a way to study the impact going forward. But now, instead of studying mothers and children for a year in the home, you could simply perform a strange situation at age 1 and then retest periodically thereafter to see how the children were doing cognitively, socially, internally, in terms of general emotional well-being. In the coming years, such research was done with a vengeance, often with compelling results. Attachment research spread worldwide. Some of Ainsworth's followers, like Alan Schroff in Minnesota and Klaus and Karen Grossman in Germany, started longitudinal studies which showed the effects of secure and insecure attachment in later childhood. The children who had secure attachments as babies had a more robust self-worth, were more confident, got along better with peers, were more liked by teachers. Let me give you the flavor of some of this work. Alan Schroff took a bunch of boys he was following and gave them what he called a ski task. Here's what he finds. The skis, Schroff writes, were really 2 long boards with 4 pairs of straps. The children had to work together to walk on these boards to the end of the path, turn around and come back. This is a really challenging task. To do it at all successfully, your group had to be organized and coordinated. The secure groups did this quite easily, usually having one person call out the signals and all moving in unison, often with their hands on their shoulders of the one in front of them. Those with anxious histories, especially the boys, had great difficulty with all of the challenge tasks. They were completely disorganized and uncoordinated. They would bicker, fool around, and become distracted. They struggled to come up with a plan. One would start before the others were ready. 1, 2, or 3 of them might get going, but they would all fall down because they didn't have another child on board. They would criticize each other, scapegoat, push each other, fall down, and devolve into chaos. Ainsworth's opponents argued that it was all a matter of temperament, of genetics. Kids were going to be what they were going to be. What parents did or didn't do was not all that important. And this proved a hard argument to counter. But new infant research kept emerging that was supportive of the attachment theme. Over the course of the 70s, developmental researchers discovered that babies were not suckling blobs. They did not live in a state of blooming, buzzing confusion, as William James had it characterized. They were, in fact, surprisingly social creatures. By the 8th day, newborns are able to distinguish the smell of their mother's milk. They are able to distinguish between faces. And by 5 to 7 months, they can recall a week later the picture of a face they were shown for less than a minute. And there was more, all pointing to a surprising mental complexity. By the 1980s, something new was brewing. Researchers began studying the interaction between mother and babies using videotape. But they did not simply play back the tapes. They played them in slow motion. The tapes revealed a world full of subtle and intricate communications between mother and child that had never been seen before. The mothers and babies engaged in what the researchers called synchronized play. Daniel Stern, one of the pioneers of this technique, reported as follows. A 9-month-old girl becomes very excited about a toy and reaches for it. As she grabs it, she lets out an exuberant, "Ah!" and looks at her mother. Her mother looks back, scrunches up her shoulders, and performs a terrific shimmy with her upper body like a go-go dancer. The shimmy lasts only about as long as her daughter's "ah," but is equally excited, joyful, and intense. Mother after mother showed similar attunements and similar ways of joining their babies in play. Video pioneer Beatrice Beebe describes a wonderful mother-baby moment that would be invisible to the naked eye. So here's a really beautiful pair, Beebe says, as she points to her computer screen. The mother is very sensitive to the baby, and you feel that when you watch it in real time. You see a beautiful pair, and it's very hard for the students to say much more than that. The mother's sensitive, she's attuned, she loves her baby loves her. But what you see in the microanalysis with the slow motion tape is that the baby at some point becomes surprised by something. You don't know what, but if you look really carefully, you see that the mother put her hand on the side of the baby's seat. You see the baby flail his left hand out, and then they both are surprised. And so you watch these two pair of eyebrows in a little surprised expression go up at exactly the same time, like in the same maybe quarter of a second. You can't see that in real time. It appears to be an extraordinary moment of synchrony, like the synchronized movements of birds in flight who soar and swoop and change directions as if sharing a single brain. And then, Beebe says, you see that baby has a little distress face, a subtle, "I'm not happy" face, and you see the mother respond very quickly with an empathic woe face. To illustrate the woe face, Beebe opens her mouth wide in a look of, "Aw, how terrible," an expression mothers frequently use to show empathy with a baby's distress. Beebe says she does that, and then the baby again shows his distress face, a grimace face, and she does a little woe face again that seems to say, "I'm really sorry." And then she makes a face that I interpret as saying, "Oh, well, maybe it wasn't that bad. Maybe you're okay." And then he makes a face that looks like, "I don't know." And then you still see her saying, "Well, maybe you're okay." And then there's another, "I don't know." And then finally, you see him go, "Okay." And just like that, all is well. Bibi laughs. "And all that you really can see, all that you really can see," she says, "all that little quarter second by quarter second by quarter second conversation, you cannot see it in real time. All you can see in real time is that they look like a really adorable couple together." Edward Tronick describes another sort of encounter between himself and a 6-week-old infant. When I purposely get too close, the baby narrows his eyes, looks off to the side, and sort of purses his mouth. He won't look at me. I get even closer, and the baby turns his head away. When I move back, he starts to peek at me. I keep talking to him and move back a little further. He makes an eye-to-eye contact, and since he can't yet fully smile, he gives me a sort of half smile. Then, when I come closer again, he looks off to the side. The infant is not only responding, he is actively behaving in a way to modify what I do. When I am too intrusive and fail to respond to his signals, he turns away. When I am sensitive to his signals, I am rewarded by his looking at me, smiling, and vocalizing behavior that would encourage me. Unquote. In the cases when mother failed to attune in various ways, the babies noticed, and if the problem was not corrected, they grew sad. In the famous still face experiment, Tronick asked mothers to make their faces expressionless in the middle of an interaction with their babies. By 3 months of age, the infants typically reacted to their mother's blank expressions with distress. You can imagine if very young children are so sensitive to their mother's misattunements, becoming distressed if their mother is slightly out of tune, what it must be like for them to be ignored for long periods, to be harshly rebuffed, intermittently neglected, or to live with a mother who's depressed and unable to enjoy her child. The British psychoanalyst and pediatrician D.W. Winnicott, a contemporary of John Bowlby's, had argued as far back as the 1950s that mothers enter a special state when babies are born. He called this state primary maternal preoccupation, which sounded almost like a benign disease. Winnicott had observed that mothers of infants put aside almost every part of their lives in order to stay attuned to the needs of their babies. He said that the attuned mother acts as a mirror for her baby, helping him to know who he is. Their interactions teach him relationships, about how to be himself with others, about staying on an even keel emotionally. She is also sensitive to his needs for her not to intrude at times, to step back and allow him periods of discovery and self-discovery. The videotape studies seem to confirm Winnicott on every point. During this time, attachment research was moving forward on many fronts. Excuse me. By studying parents' attitudes towards their unborn babies, researchers were able to predict whether the parent's child would turn out to be secure or insecure at 12 months of age. Quality of attachment in early childhood was shown to have more and more repercussions throughout later childhood. Adults were found to fit into similar secure and insecure categories. And Mary Main, a former Ainsworth student, showed that adults tend to pass on their own quality of attachment to their children. It was found that a child's quality of attachment could be secure with one parent and insecure with the other. New data was unearthed about the contribution of fathers, and most attachment researchers came to believe that the mother did not have to be the primary caregiver, that the father and others could also play that role. In 2005, Arietta Slade reported dramatic examples of a new element in attachment research, namely the parent's capacity to reflect and to see herself and her baby as psychological beings. Some of the mothers Slade studied had little notion of their baby's inner life. When asked how their baby responded to separations, they may say, nothing, or fine. Others bring up unrelated aspects of personality. He's cute. He's pig-headed, or he pushes me around. Still others may describe the baby's behavior, but indicate no awareness of the emotional state behind it. She clings to me, but she's fine. She wakes up the night screaming, screaming, but nothing really bothers her. Or they seem not to know that an inner dimension exists. If the baby throws a tantrum, she's bad. If the older child is listless and unmotivated for school, she's lazy. In the worst cases, Slade found malevolent attributions. He's just a devil, just like his father, and I have to keep a close watch on him. Or she's bad, 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 and there's nothing can be done about it. In a later study, one mother insisted her six-week-old was giving her the finger. Other examples of defensive projection or self-enforced ignorance included, he doesn't notice when I'm high, it's all the same to him. Or, she doesn't remember the time she was in foster care. Or, there were some really bad times, but nothing affects her. And then, of course, there's the calculated distortion of the child's experience, as in, I know you hate seeing your daddy since he left us. This addressed to a child who had just returned from a treasured visit to her father. In each of these cases, we find, says Slade, mothers who simply cannot or will not enter the child's experience. Excuse me. Many of these parents have a similar incapacity regarding themselves. They deny awareness of commonplace parental feelings like anger, guilt, or joy, and they deny some aspect, often terrifying, of their own early experience. I don't remember my brother raping me. It's in the past. It is easy to imagine how mothers in this group might get out of tune in face-to-face communications with their babies, giving them confusing, if not malevolent signals about who they are. But none of this research could stop the mistrust that many felt about the message. Daycare has been a source of furious debate, especially full-time care for babies under 6 months. How could both parents work if their babies depended so much on one of them being home? How could they not go back to work if their careers depended on it, or if the family could not get by on one income? They didn't want to hear about attachment reports suggesting there may be dangers in starting children too early in daycare. It made them feel guilty, trapped, and angry. But the truth of the attachment idea was getting harder to deny. New studies found that genes did not, in fact, determine character or any other aspect of psychology. Genes were not destiny. Genetics could take a child in one direction or another, depending on what the child encountered in his home life. In neuroscience, a whole new field of behavioral neuropsychiatry was coming into being. Attaching electrode to the baby's and mother's brains, these scientists found a whole world of implicit communication, much of it going directly from the mother's right brain to the baby's right brain, and vice versa. All of this outside of cognitive awareness. The work of the neuroscientists is still very young, but it may in time provide the kind of hard science support for attachment theory that Bowlby himself had craved. Excuse me. What's more, it has demonstrated an intense level of communication between mother and baby from birth, such that much of what we once thought of as inborn temperament, in fact, comes into being in the early days of life. Attachment research has brought us face to face with the price we've paid for living in a modern world. Scolding parents will not help the situation. We're not the same people we once were, people who lived in small villages, whose identity was more tied up with community than with oneself, who could rely on extended family for help with childcare, where children ran in and out of each other's houses and were welcomed everywhere, where there was no such thing as career, and were where mothers could only stay at home. We do pay a price for insecure attachment. For the individual, it is an impediment to love, self-respect, and well-being. That alone is enough for concern. But it is also a cost for society. People who grow up with dominant, insecure self are inclined to feel deep down that they are unloved, or in some essential way even victimized. Such feelings often leave one with a broader sense of alienation, of not being wanted, of not belonging. Every society suffers from a certain amount of indifference on the part of its members, and every society has destructive impulses. But if such forces are not to gain the upper hand and destroy our sense of community, we need to invest in secure attachment. There are simple ways to do that. We need family leave so that at least one parent can put himself into the full-time job of caring for a new infant during the first year. We need to invest in quality daycare so that parents can go back to work confident that their young children will not be damaged by ignorance, lack of training, or neglect. We need intervention programs that bring nurses and social workers into high-risk homes on a regular basis. They can educate young mothers on the needs of their babies, help them understand the baby's signals and their own responses, and give them counseling when needed. One such program in New York called Minding the Baby, the brainchild of attachment researcher Arietta Slade, has already shown a remarkable ability to increase the number of securely attached children in high-risk homes. The price tag for such programs will be high, but nothing like what we're accustomed to when it comes to bailing out failing banks or waging even a small war. If we decide we want this and are committed to having it, it can pay huge payoffs in quality of life and may even have a financial payoff. Meanwhile, we can enrich our modern experience with some of what we lost in the passing away of traditional societies. Thank you.
Thank you very much, Dr. Karen. That was a very informative presentation.
Thank you.
Covered a lot of ground there. I see that there's a raised hand. I'm going to take the typed questions that are in the Q&A box first. So let me do that first. Now, someone is asking, are there trends when there are multiple birth children, like twins, for example? So I guess what the person means is, will each twin have the same attachment style? And if not, why not?
Well, it's a great question because actual studies have been done with twins who were separated at birth and raised apart. And those studies show that an obvious component that's genetic. For instance, one person in 100 is likely to become schizophrenic in early adulthood. But if you have a twin who's schizophrenic, and then you look at the sibling has a 50% chance of being schizophrenic. So there's obviously a genetic input, but there's a 50% chance that other sibling will not be schizophrenic, which suggests the power of the environment. But ultimately, what's been found and what I think is very important to recognize is that what the geneticists find and what makes them so excited about the inborn traits that we all have never includes the question of love, where love, attachment, self-regard, good relationships, where all that is concerned, that's a result of parenting, of first relationships, and not of heredity. I hope I answered your question. Books have been written about it.
So if that's that sounds like a complete answer. If it's not, then I'll encourage that person to put more into the Q&A box. Thank you. Sai is asking, sorry, I said your name. I have to drop that out. Do environments like the kibbutz with arguably diminished maternal attachment, but ideologically and socially driven cooperative styles achieve cooperative socialization and good adjustment of the kind that's sought for in the ski experiment, for example? And he continues by saying, are there known differences in the prevalence of attachment problems among societies, regions, populations, or ethnic groups, or social classes?
Poverty is not helpful. Poverty really sucks when it comes to attachment because it puts families under so much strain. And parents who are badgered by poverty and often carrying down two jobs and raising insecure children are not any less loving than parents with secure children. They just don't have the time. They're just exhausted. They sometimes are single parents. It's all these questions are part of the mix. On the other hand, if you have a stable family with two parents and in a state of poverty, very often, and there's a good relationship there and a good relationship with the children. Very loving parents find a way to raise secure children. In many cases, anyway. Now there was a lot more to that question. The kibbutz. Mm-hmm. Very complicated question also, and there's been studies on it by attachment researchers. One of the things that was found is that children raised in a dormitory, not raised in a dormitory, but who sleep in a dormitory at night all together with one person on duty called a metapellet who's available for emergencies. These children are more likely to suffer from insecure attachment than children who sleep at home. And they've almost entirely, as I understand it, have abandoned the sleeping dorm in kibbutzes. From my understanding, that is probably one of the main sources of weakening the maternal or parental bond, was the sleeping away from home. I can't speak on what the other influences may be that would have detracted from that bond. I'm not sure there would be any. As for increased social feeling and participation and brotherhood, yeah. I mean, wouldn't it be great to grow up in a kibbutz? It's sort of like the old-fashioned village. It just had, some crazy ideas about how sleeping arrangements should be organized.
Thank you. The next question. Is there research on the influence of poor attachment in childhood on the life of that person when they become an adult?
I think what really is important is the quality of parenting and the quality of child attachment throughout all the childhood years until the child leaves home. That being said, there are some direct links from year one to adulthood. They're few. They're significant. They're interesting. But the But the main thing you have to look for is how the attachment, quality of attachment builds over years, or how it gets improved or ruined or damaged. Sometimes adolescence undoes a lot of good attachment because parents just simply don't know how to handle it. But yes, quality of attachment in childhood affects quality of attachment in adulthood, especially if you consider childhood as a whole.
And in fact, I was looking at your book again, and I believe you talk about, you quote some research where people with insecure attachment have more trouble in their marriages. There's more likelihood of divorce and so on.
Well, this insecure attachment we're talking about is adult attachment. There's a separate way of looking at adult attachment. It's not exactly like child attachment. And it's also got amazingly interesting studies. I was in graduate school in clinical psych when I first came across attachment theory. And I was immediately struck by this one study that was just one of many, but it was so clever. So why am I bringing this up? What was your question?
I'm asking about whether the childhood attachment style carries over into adulthood and leads
Yeah,
to things like divorce or other problems in relationships.
it depends on when that quality of attachment is in childhood is evaluated.
And what you're talking about is that adult attachment is a different beast.
Yeah, in other words, attachment quality has four very broad categories. There's the secure on one end, and then there's this disorganized, disoriented on the other, which is usually the quality of children who've been seriously abused. In between are two insecure attachment qualities, one called ambivalent. Well, that's what I call it. That name seems to be dropping out of style. It's also called resistant or just plain anxious. But anyway, I'm going to call it its original name, which was ambivalent. The ambivalent child, the ambivalent insecure attachment style, is someone who's very emotional, um, who's had an inconsistent parenting, who's always like um, challenging the parent, um, is overly obsessed with the parent, who she wants to, in some way, cure. And this gets carried into other relationships. A sense of not, not trusting. And then the other insecure attachment, but this shows up in adulthood with similar symptoms. Also, it's not called ambivalent, but it's um, I forget what it's called now. But
Preoccupied?
yes, preoccupied. Thank you. And similarly, the child who is avoidant, who doesn't make a fuss, who hides all his attachment needs, who makes them unconscious, that avoidant child has an adult corollary. And very often, the quality of attachment of the parent, of one of the parents, shows up in the child. So, yes, quality of attachment in childhood affects quality of attachment in adulthood, especially if it's evaluated late in childhood. But it's not a guarantee because so many things happen along the way. Even in the second year of life, quality of attachment can take a major turn. A parent who has been unemployed gets a job. A father who's been missing comes home. Um, all kinds of things can change. Children are flexible. That flexibility reduces over the years, but it becomes real again in adult and adolescent. And this has been shown genetically. that there's another chance in adolescence. So there's lots of change going on, depending on the quality of the environment. And so, yes, you can say that there will be a certain amount of people who will have the same attachment quality in adulthood they had when they were one, but it's rare. It's not
Okay.
enough to be significant.
So a person's attachment style can change at various times depending on their life biography.
Yeah.
Okay. Thank you. Next question. Great talk.
Thank you.
Effective relationship building at an early age appears to be a foundation for successful interactions in later years. There seem to be many parallels with the behavior that is needed by those in a leadership position dealing with adults. The relationship building continues to be effective in building human potential and capability. What would you think about that? Do you have a reaction?
Yeah, my first reaction is we come from different worlds. Person who asked the question and me. I don't. I have I have people in my family who've worked in personnel and in team coaching and executive coaching, and I know it's very valuable to people in their work life. I'm not sure how much it does for them in their relationships, in their personal relationships, or especially the most intimate relationships. That's where attachment issues show up. Um, and then there's me. I'm a therapist. I think that's where people change the most profoundly. That's where learning how to relate, both learning what's off about your relating, understanding why, grieving, being a friend to your sadness and the pain of looking back at what you did and didn't get as a child. Um, all these therapeutic issues, I think, they're the most powerful from my point of view. And uh, I mean, I'm not familiar that much with, the other ways of approaching this.
Okay, fair enough. Next question. What are the best ways of managing a tantrum without damaging a parental attachment?
Great question. I had one thing that I learned when my son was a toddler. He would throw a temper tantrum, and I'd want to wring his neck or throw him out the window. And those impulses were very strong. And the only thing that worked for me was getting down on the floor and saying, "Okay, now Daddy's going to have a temper tantrum." And I'd punch the floor and I'd wail and I would cry, look up to the sky or to the ceiling and cry to the gods. Why did I get this crazy, complaining son? I wouldn't say crazy. And as soon as I started pounding the floor and wailing, I'd see a little smile curl up on his lip, and I'd know that the uh, the fever had broken, so to speak. That's what worked for me. You need to be creative when kids are maddening, because if you let yourself, the insecure part of us actually gets very challenged. That's another thing I didn't mention in the article I read. Um, that we all have, I think, insecure. I know we all have insecurities. We all have an insecure part of our personality. If we get checked out, they may say, "Oh, you're secure," but they mean majority secure. There's always a minority position, and it can be pretty strong. It is strong in a lot of people, most people. So the non-cooperation or the complaining or the screaming temper tantrum of a child challenges our self-love, makes just totally destroys our sense of being a good parent. We feel guilty when it would be much more valuable to stand back, have a kind of, remove oneself emotionally from the situation and find something that has some humor in it to deflect.
Thank you. It reminds me of a scene when I was working at the hospital for sick children in Toronto. I was gathering information from very young children, from age 5 and up. And I was in the waiting room recruiting people who were waiting to see the doctor about something. And there was this one boy who was really tired or fed up or hungry or whatever it was. And he was lying down on the series of seats, crying and crying. It was like a tantrum and wailing. And his mother kept saying, you know, stop crying, stop crying. And that was having no effect. And he was just getting worse. So I kind of put myself kind of into a more horizontal position. And I looked at him and I didn't actually make wailing sounds, but I did all the facial mimicry of wailing and crying and being very upset and looking very, very sad. And first of all, he looked at me like, what's that? You know, and he started to get involved and then he started imitating me. And then he got up and he kind of made a little hop and a skip and he went off and sat somewhere else.
You've
And
done your job.
he was fine. Kind of creative empathy.
What
I
I
guess
was saying before about parents in that situation, I realized I didn't quite finish, is that it puts a hook into our own insecurities. And that's what makes us want to react so violently.
yeah, yeah it's always there's always something in us that gets touched. It's such a basic part of our
Mm-hmm.
personality. Yeah. I guess it's the same when you're a clinical psychologist. You have a patient who comes in. They're not always just sitting there, you know, having a chat. Sometimes they might get upset.
Oh, sure.
And I guess it's
I have some scenes like that in my book.
okay. Okay, the next question. Has there been any interesting research done on children being raised in polyamorous households?
You know, there's been so much attachment research done. It wouldn't surprise me if that too was done, although I guess finding enough subjects could be a challenge, but maybe they have their organizations. In any case, I have no idea.
Fair enough. Next question. Given your comments about sleeping away from home, what are your thoughts on sending children to boarding school?
Well, it depends on the age. I personally would have a lot of trouble doing that before. I wouldn't want to do it at all. I want my kid at home, but there are sometimes good reasons for it. And I think the earlier, the worser. Um, I'd want to be, I guess, in the teens, you know, work high school age. But I'm not an expert on this. You know, I'm dealing with one family right now whose son is in boarding school, and it seemed like a magic bullet for him. It just really enabled him to stop looking over his shoulder, to be more relaxed. He was in a very high pressure Manhattan school, and he suddenly wasn't getting in trouble anymore. So it can be wonderful. But he also had his parents every weekend because the school isn't that far away. And there was no sense of his being banished. And everyone, you know, was enjoying themselves.
So it depends on how the whole situation has been handled then.
Yeah, a lot depends on the school too,
Yeah.
whether it's, you know, whether he's going to find it to be a warm and comfortable home.
Okay. Next one. Are there some strategies more especially effective than others regarding maintaining strong attachment relationships with older children as younger siblings arrive?
Huh. That is such a big issue for attachment. And parents get it so wrong because, okay, is it, let's say, a 2 or 3 year old girl and she gets a brother who everybody is cooing over, right? And the parents-in-law are coming and staying and spending time with them and billing and cooing about the baby. And the baby, well, the baby, the toddler, no, not the toddler, I guess the preschooler, the late toddler, just gets more and more angry and oppositional and creates problems and is provocative. And my patient just wants to kill her. And he sometimes gets angry. And I say, you can't get angry. She has just been, gone through a terrible, loss of being the baby in the house, the one who gets all the glory. Now she's been subject to this intolerable situation of a second baby coming along and the baby getting so much attention that you really need to have tremendous patience with her and guide her and reassure her. Anyway, both parents started being that way with her, being more patient, and she's really been coming around nicely.
So that's working. What you're doing with them.
Yeah. Now that's a problem of early childhood, very early childhood. Children who are older, it's really a question. Well, in any case, there's always a question of what's going on at home between the parents, between the child before the newborn came along, all these things. But in the case that I spoke about, they had a good relationship with this little girl. I met her. She's adorable, and and there was no reason for the relationships to go south. She was just having a very hard time adjusting to a very tough situation where she had been queen and now was, like everybody else.
Okay. This next person's asking, does Dr. Karen still see patients? If so, how can one contact him? So
I
first of all,
do see patients, and you giving out my information anywhere?
well, I could send this person's information to you,
Yeah,
and then
yeah,
you could contact that person.
yeah. That's good. That's the best.
So whoever you are, if you want to email me, you have my email address because you must have RSVP'd. And then I can forward that to Dr. Karen. Okay, good. Next question. Do children who may be on the autism spectrum need a certain kind of parenting style with regard to attachment theory?
I could only guess. Children who are on the autism spectrum demand of the parents a whole new way of imagining what it's like to be closely related to a child who has a hard time showing affection, who doesn't want to be touched, whose buttons get pushed easily in ways you would never expect. Um, I don't want to say too much, except it obviously demands a lot of the parent in terms of rethinking what attachment means, what's possible, and what will enable a good enough attachment with this particular child.
And even a person with autism has emotional needs.
Absolutely, and can be secure or insecure.
Yeah. Okay. I have a couple of comments and questions of my own, if you don't mind.
Oh, that's terrible, but let's try it.
The first one is that I recall I was in a training program. I think I had I'd gone out of town for a training program on the adult attachment interview. And Mary Main was there with Eric Hesse. And we were watching a tape of what they called a disorganized baby. And in that tape, the baby was with the mother in the playroom where the strange situation had been conducted. And then the researcher came into the room, and the baby crawled straight to the researcher, very determined crawling straight to the researcher. And Eric Hesse said, look at that. Look at that. Not even close to the mother. That's disorganized. And I thought, but that baby does have a strategy. That baby wants to be adopted. I was so shocked at the reaction. But I don't know if that's like, I don't know what you have to say about that, because that may not be the only type of response.
I thought what you said was very creative and makes a lot of sense to me, although because the child is disoriented, disorganized, I have other suspicions that, for instance, one of the one of the frequent causes of disorganized attachment is abuse. It's really just the reason why it's disorganized and disoriented is because you're being abused by the person you want to go to for safety. And so you see these children, these disorganized children, when a mother walks in the door, instead of running straight to uh, the, the psychologist, the observer, um, they usually start toward the mother, then run in the other direction, and then sometimes they freeze and don't know which way to go. It's very confusing for them because they want they want the same person they're afraid of. And I think that's what was being displayed. I want someone, but not you, or I want a better you, or uh, it may just be like there's someone who maybe will do it right. So which is kind of an attachment, I mean, an adoption issue, if only for the moment. Um, but it's terribly sad because they find it very hard to have relationships. Their communications are strangely off. Um, they can't trust. It's not what you'd want for your child.
It was certainly very tough for me to watch that. Now, the next one I wanted to ask you. I actually have an anecdote. When I was at the hospital for sick children, before I got hired, I spent a year there as a volunteer. And I had this wonderful volunteer assignment where I was working with the late Dr. Sue Goldberg. And she had gathered all these wonderful videotapes of the strange situation, which, for the sake of the viewers, I'll say that you had described this as the mother and the child in the playroom. The mother leaves, comes back, a stranger comes in, and so on. There's all these different episodes. And what I noticed, I had to watch these videotapes and edit them because the babies were coming in at 6 months, 12 months, 18 months, and 24 months. And at 24 months, the hospital was giving the mother an edited video of the good moments from the previous 3 visits as a way of saying thank you. That was their reward, okay? And the child got a great big huge candy. So my job was to go through all these videotapes and edit them. That's why I say it was so wonderful for me. And what I seemed to notice, I wasn't at the point in my own studies yet where I was making an experiment out of it, unfortunately. You know, I wasn't gathering data as I was watching. But it seemed to me that the babies who seemed to me to be securely attached, when they got to the 18 months and they had problems they had to work on with their mother, like moving objects and catching things with hooks and, you know, complicated problems that the mother would have to be there or not to say, you know, try this, that the securely attached children were solving the problems, whereas the other ones weren't.
There's research to that effect. One of the earliest of the attachment researchers studied that very thing.
So it's the relationship between secure attachment and a greater cognitive ability to use your cognitive
to use the operative expression, because they get flustered easily and don't use what they have. They don't feel confident they can do it. But that doesn't mean they can't do it or don't have the skill or the cognitive ability. They don't have the emotional ability to withstand frustration and to be optimistic.
Okay. Finally, I have a comment, or actually it is a question. You got into the subject of daycare and how daycare was seen early on in the days of attachment theory. What are the attitudes now towards putting children into daycare?
They differ. There's a lot of differing. There was a huge study begun in the 90s and didn't finish up until maybe it's still going, studying children who had been in 20 hours or more of daycare before the age of 6 months, or those who didn't. I'm not sure that's exactly right, but there was a study along those lines. And they used a quality daycare option. So the children were, taken care of by people who were well trained, and there wasn't a huge staff turnover, and there weren't too many babies to each watcher and observer, not observer, watcher, babysitter, minder, alternate parent. And daycare looked like it was okay. And so for many people, that was the last word. Daycare is okay. The study shows it. But the study doesn't, but very often the people who are satisfied with that study don't include the problem of poor daycare. So I think, and many, many others do. So there's kind of a joint appreciation at this time, at least of this basic fact, that where there's good daycare, you have a much better chance of preserving the child's security of attachment. And if you've got fly-by-night daycare, which is the way most daycare is in this country, then there are more risks, especially when it's very early in the child's first year.
Fair enough.
Basically, I think there's a pretty wide agreement on that, but people stress different things.
We have one final question for you.
Okay.
Okay, you've answered a little bit of this, but not all of it. Can adults who may have suffered from poor attachment to their primary caregivers, lack of trust, or unconditional love heal from this lack? And what are the best ways to do so, in your opinion?
I think dynamic, depth-oriented psychotherapy is the way to really heal, because it's not a how-to therapy. It's not like, think about it this way or try this behavior. It's much more about going through a mourning process, getting to be on your own side, developing self-care, um, learning a new relationship with the therapist or in group therapy with the other group members, getting feedback about who you are and how you affect people. This probably could go on, but I think that is what I would recommend.
That's a very in-depth response. Thank you. You
Sure.
really enumerated the whole answer there, step by step. So at this point, Dr. Karen, I would like to say, on behalf of Toronto Mensa, please accept our thanks for your very in-depth and inspiring talk.
Thank you. I have one thing to say.
Okay.
You held up my book earlier.
Yeah.
That book that you held up is still available on Amazon, but it's not what they should buy. It's this book.
A new edition.
This is the third edition, and it's about 40% new material, and it's gotten rave reviews.
Yes.
If I do
Spectacular reviews.
accurately rave.
Yes. So you want to buy the 2024 edition.
Right.
You're out there.
It says on the bottom 30th anniversary edition, which is blows my mind.
Yes. So I would like to say thank you very much. And I'd like to let you know that as a sign of our appreciation, we will be sending you a small gift.
Okay.
So you can expect that to come.
Thank you. I'll look forward to that.
So this was really wonderful. And thank you very much. And thank you again for giving us permission to record today.
Okay. You're welcome.
Other people can watch it. So I'll say goodbye to you and I'll say goodbye to everyone. And so thanks to everybody and thank you for all your questions. That was really great. We had a high level of participation. So bye now.
Bye.